Welcome, everybody, to the Mission Employable podcast, where we're talking about all things workforce here in Iowa. I'm Ben Oldak, joined, of course, by my co-host, Kathy Leggett. Kathy, how's it going on this Monday?
Good. Hello, everyone.
Awesome. Well, in this episode, we're going to be talking about how an Iowa-based organization is working to recruit more community health workers to fill the need here in the state. And on the show with us today, we have Angie Doyle Scar from the Iowa Department of Health and Human Services and Deb Kazmerzak, Program Director at the Iowa Chronic Care Consortium. Welcome to the show, Angie and Deb. How you guys doing?
Great. Thank you so much for having us.
Yeah, glad to be here.
Awesome.
Thanks. Yeah, I want to say, I always want to at times put my 2 cents worth in. I want to say welcome to you both as well. And just, I'm so thankful that they're here. These two ladies I've worked with over the years on various projects, and they have done amazing work. So this will be a great, stick here, listen to us. They've got great info to share.
Excellent.
Thank you, Kathy.
So first of all, Deb, why don't we start off with what the Iowa Chronic Care Consortium is and what it does?
Yeah, sure thing. So Iowa Chronic Care Consortium, ICCC for short, is a nonprofit organization located in Des Moines, formed in 2002 to really test messages to improve management of chronic disease. And from that grew a clinical health coach training program. They provide that training program now throughout the country and even internationally. In 2016, I joined the organization and we kind of broadened our focus to community health workers. That was a personal interest of mine, and so kind of a good alignment between me and the organization. So in 2019, we developed a training program for community health workers. But really, since 2016, we've been just doing whatever we could to increase awareness, promote utilization, because we just really believe this is a valuable workforce and really important to health and human services in Iowa.
Great. Thanks for giving us that overview. Now, what we want to know next is like a little more about what the community health worker is. I think that's a new term to a lot of people. Maybe when you're working in the space, it becomes pretty familiar. But I really want to take this opportunity to let people know what this is and the responsibilities and how it can really make that impact you talked about.
Yes, I'm so glad you asked that question, because this really does kind of require some explanation. It really is an umbrella term, community health workers. And I think the reason that it's so confusing is they work in a really vast array of organizations. So they might work in a human services agency, they might work in a healthcare agency, they might just work in a public or neighborhood center, or just a completely different kind of agency. So that's one way that it makes it confusing. The other is that many times they have a different job title, thus the umbrella term. So the national organization often says that there are at least 170 job titles that would fall under that umbrella term. So this is why it's really good to kind of talk about what we mean. So there are some formal definitions out there. The American Public Health Association and the U.S. Department of Labor have their sort of formal definitions. But I would rather sort of summarize in a way that's meaningful to me, I guess. So the common threads, even though they work in different kinds of organizations and they have all kinds of different job titles, the common threads are in who they are and what they do. So who CHWs are, they come from or have a really deep understanding and appreciation of the community that they serve. So they're really familiar with and can really connect with the population that they serve. And then the other general education requirements, I guess, for CHWs are really just usually high school diploma or equivalent, though sometimes there is college or formal training. I think it's more about the personality and those softer skills, I guess. The ability to engage and really connect with people is more important than the educational background. But different agencies might have different job requirements.
Are there a couple, I just wonder if there are a couple agencies that you can give us an example who are utilizing community health workers around the state now, just to give people an idea.
Sure, there's all kinds. The local public health departments, certainly all of the health systems, both at like hospital level or at like primary care clinic level, but also homeless serving organizations or low income housing. just really all kinds, health, even some of the child welfare agencies.
Mhm. And I would just add, your nonprofit organizations that actually are in the community in which a community member would go to seek help and receive services. Frequently, that person that would help them navigate those services, sometimes specialized like housing, but even that bigger, the array of services an individual may need would be a community health worker.
And you mentioned that there are over 100 actual job titles that fall under that umbrella. Can you give an example of one or two so people might have an idea of what were people that fall under this umbrella?
Yeah, sure. So navigator, patient service representative, patient advocate, care manager or case manager, care coordinator. There are many.
Sure. And this occupation has evolved over the years. How has the field changed, and what do you think are some of the benefits for these workers?
Yeah, so community health workers have really been around a long time. In the U.S., you first started seeing them in the 1960s, often with the title of promotoras, and they worked with the Latinx community. Then you kind of saw them again in the 1980s as part of the HIV/AIDS crisis. What happened was people were not getting care or were getting care and then falling out of care. And so it was a way to engage peers to encourage people to get back in and maintain care. And then I would say in the last 15 years or so, there's really been a resurgence in use of community health workers. And really it's because healthcare overall has realized that we have to address things like poverty and neighborhood violence and low education levels if we're really going to improve health outcomes. So a lot of times we call those social determinants of health. And so healthcare is realizing that. And so going to the community health worker that can really engage and understand the population that they're working with and therefore establish trusting relationships is a really effective strategy. So there's really been kind of an explosion in this population over the last decade, 15, 20 years.
Awesome. So, Angie, if you could tell us a little bit about the training program that you guys have going on now, and then I think I have some follow-up questions with that, but just
Sure.
give us the overview now and we'll go from there.
Sure. So HHS, Iowa Health and Human Services, the Department of Health and Human Services, received a grant in September to train more community health workers across the state. They received that grant from HRSA, which stands for Health Resources and Service Administration. There are three major components of that grant. The first is a community health worker professional skills training. That is the first component that will be to train the community health workers across the state. Even those who are currently community health workers, this is a way to offer a consistent training for those who even are currently serving those roles. This training will consist of 30 hours online on demand. The goal is asking that we train at least 288 community health workers. There is usually a cost to a tuition for this training, but because of this grant, as long as people qualify and eligibility is very simple, that tuition is waived. We're also offering a stipend for those who qualify. And that stipend is a cash payment to help offset costs that somebody may incur while they are going through the training. Once through the training, that individual will receive a certificate from DMAC or a community college of their choice. The training is a rolling enrollment since it's online. So we hope to have the training ready to go in April. And once it's up and going, people can sign on and start to participate in the training at their convenience. The second part of that training, the second part of the grant is a community health worker registered apprenticeship program. This is much more comprehensive, a lot more hours, and Iowa Chronic Care Consortium is the intermediary of that apprenticeship. And so what that means is usually the employer is the apprenticeship, but Iowa Chronic Care Consortium is that intermediary who I have a tough time pronouncing that word.
It's okay.
It's an
No worries.
intermediary, and they do a lot of that administrative work that an employer may find cumbersome. So the Iowa Chronic Care Consortium will make it as easy as possible for that employer to be willing to sponsor an apprenticeship. an apprentice. Those classes are also online, but they are live. So there will be designated times each week for those members to participate. That tuition is also waived, and there's a stipend for this one too. And it's actually quite a bit more because it is a much more comprehensive, robust. The first cohort we hope to start in April. And once the person gets through this apprenticeship, they will have a credential, a national credential that will be accepted nationally. So if the community health worker was to leave Iowa and they were to go to Missouri, that credential could go with them. So the last component of it is a public health training, more specific, and we're still developing it, but it will be offering a training for existing community health workers to be more specific to public health. I mean, during COVID, if we would have had this trained workforce across the state, across the country, working with the populations that we had the hardest time serving, it would have mitigated, I think, some of the obstacles that we found.
For sure.
And so we are hoping to train community health workers across the state on specifically public health topics.
So the
Go
first,
ahead.
if I could just jump in
Yes.
for a second. So the first two components that Angie mentioned, those are the comprehensive, basic, kind of fundamental community health worker training and two different ways you can take it. Then the third component is not that kind of comprehensive, what is a CHW and all the other things that are covered in the others, but one that's just really specific to public health.
Yeah, like a specialized, piece of that career.
Right. So in
Yeah.
a perfect world, you would take one of the first ones options first, and this would be like a continuing ed or a specialization.
Mm-hmm.
And then they would also receive then the public health certificate as part of that. One of the exciting things about the grant is that our partners that we have already involved. I mean, the grant has just started, but we already have obviously the Iowa Chronic Care Consortium, the community colleges. I mean, that will be very instrumental in the success of this program. We have obviously the Department of Health and Human Services. Iowa Workforce Development is one of our partners, and we're working with the University of Iowa.
Yeah.
Great.
And that kind of brings me up to something that I wanted to talk a little bit about, was that once these people get trained, that's great, but now they have to be hired and put in place with employers. So can you tell us a little bit about some of the employer partnerships that you are working with in order to get these people out working?
Sure, I'll jump in. This is Deb. So as Angie had already talked about, Iowa Chronic Care Consortium has a registered apprenticeship program and in the intermediary model, as Angie mentioned. So that really enables us to partner with many employers at once and across kind of that spectrum while still shouldering, a lot of the responsibility or the burden of the federal apprenticeship program. So that's a benefit to the employer, I think, not to have to worry about the details, but they know that we'll kind of walk them through that and kind of hold their hand through the apprenticeship process. We find that the registered apprenticeship is still new to healthcare, and so I think there's some comfort for employers to know that they don't have to sweat the details, but that, again, there's someone that will make sure that they're crossing their T's and dotting their I's along the way. And I think it gives employers confidence in the quality of the training because it has been blessed or approved by a federal agency, the U.S. Department of Labor. So I think they know that it's a quality training program. And it's really a great recruitment and retention tool for employers to offer that career path in a really meaningful way to the student.
Yeah.
Yeah, and I was just going to add to that real quick. I mean, we're doing outreach right now. And not only are we doing outreach, but we're educating people. And so employers are obviously one of the first partners we're doing outreach efforts to. They are already frequently employing those community health workers. So that is the best venue for us to reach out to those community health workers and let them know of these opportunities. And then understand, to help understand the benefits of a trained workforce. Employers already get it. So we don't have to convince them of the positives of the training. So, so employers are obviously the best place for us to do that initial outreach.
Yeah, so we want to help get the word out. So there's a couple of great opportunities here. Number one, for employers who already have community health workers in their employ. This is a great, and Deb, you mentioned retention and recruitment, because I think that's really important in today. Those are two of the biggest priorities. And if you can have that career path, so you might have employers thinking about who do they have, who they have been great employees, and they might want to make this opportunity available to them. And it's not going to cost anything, and they're going to get a so employers want to be thinking about that too.
I'll give you a great example of that, Kathy.
Mm-hmm.
So one organization that we've worked with quite a bit is training all of their interpreters as community health workers. So not only is it a way to keep that valued interpreter, but it's kind of a bump up. You know, I mean, it's growing their valued employees into another role and really investing in training them. So
Great
I
example.
love that
Great
model,
example.
And I love it when there's a career ladder potential for it.
Yeah, and that's again where employers, if this is something you're dealing with, encouraging you to think about this is the career piece of it, the career ladder for your employees, because you want to retain those good employees. That's a great example. Another piece that I want to point out that I heard you both talking about is, I think for somebody in Iowa who's listening, or if you're listening and you know somebody who's passionate about relationships and health and healthcare in general, and just those social determinants, all of those things, this might be a career path for them, and a good career path. And training is available, a stipend's available. They aren't going to have to take debt to do it. So I just want to emphasize that too. And I don't know if one of you wants to just again push on that. Like if you think this is a fit, or you know somebody that this is a fit for, where can they get information, and where can employers get information?
Community health workers is where we see it overlap public health, the healthcare system, and human services. And so some people may not realize that frequently those are three different pots in which people work and seek services. And so this is an overlap of all three. And so this is a great way, as you talk about a career pathway, to dip your toes into seeing, am I interested in this? And while they're taking this training, it can be, again, a universal umbrella of all three of those areas. They may decide, I'm really interested in the human service aspect of it. I can look at DMAT for their 2-year human service degree. I can go on to, a 4-year degree in social work or human service. Maybe I want to be a nurse. And this would be a way to introduce them to, these different pathways because it overlaps 3 different sectors.
For sure. And I was going to ask, how should people find out more information about either the Iowa Chronic Care Consortium or this program if they want to get involved?
Absolutely. So we need to plug our website.
Absolutely.
So communityhealthworker.org, brand new website, just up and running in the last couple of weeks. So even once you get there, we have a little video on what is the Community Health Workers Professional Skills Training and how do you access the tuition waiver and the stipend. And really soon we'll have another video about the registered apprenticeship, so you can kind of compare and contrast. But I would also point people to the frequently asked questions on the website, because there are a lot of questions, and especially on the registered apprenticeship, as you guys well know, it's kind of a confusing program. It's new in healthcare. People have never heard of it before. So we try to at least begin to address those questions, and we'll keep adding to that all the time. And the website is still a work in progress, but there's a fair amount of information on there as well. And, like a place to send an email if you want to keep tabs on when the training is available or have questions.
Okay, another question I have is there like minimum age for enrollment?
Oh, great. Age 18.
Okay, 18. So again, people interested in the healthcare field, just as you explained, this is a great way to get a credential, to not have debt, to make some connections, to learn, and to start or move your career in that direction. Yeah. So,
and we really,
awesome.
Want to get the word out to all of the Iowa Works offices, and looking at the workforce development partners in this, in identifying those job seekers that, again, like you said, Kathy, have the passion or have the heart for this kind of work. They might be working in some other occupation that is not very fulfilling, but would like to branch out. And especially the professional skills domain training, since it's on demand, you could have your full-time job and still take this when it's most convenient for you. So.
Right. And then also, again, to plug the number 2, the second one you talked about, the registered apprenticeship, which is usually an earn and learn type of thing. Right. So, we love those programs as well. So I don't want anybody to miss this opportunity.
Yeah, absolutely. Well, thank you guys so much for coming in to talk about this program. Obviously, the need for healthcare workers has never been higher, and we've certainly had a lot of lessons learned through the pandemic, and now that we're kind of still working through that and kind of out on the other side, we're now able to kind of make good on some of those lessons that we learned. So
I also actually, sorry, Ben, you always wrap up and then I jump back in. But also wanted to say how many federal grants were awarded. I think this was a lot of work that was put into that. So I do want to acknowledge and congratulate you guys and your partners on the work that was done to bring this project and opportunity to Iowa.
Yeah, so I think there was about 70 awards.
Okay.
We were one of the only statewide grants.
Awesome.
A lot of them were very specific to communities. And in fact, the application suggested that, but we really felt like we needed to offer this statewide.
Great.
And one of the focuses is our rural communities also. And we're not excluding urban, but there's a focus on doing outreach and having community health workers in our rural communities also.
yeah, that's a big thing for sure.
And so, just to mention, and again, statewide. So it doesn't matter. You don't need to live in Des Moines to take opportunity, have this opportunity.
We would actually like it if we were reaching people outside
Yep.
Des Moines, in addition to Des Moines, obviously.
For sure.
Yeah.
Awesome. Well, thank you guys again so much for swinging by the old podcast studio here. We're happy to have you and wish you all the best of luck in this project as it continues through the years.
Yes.
Thanks for having us.
Thank you
Thanks.
so much.